Okay, I'm recording now. Okay, so today is what, September 28th, 2018. Okay, so please go ahead and get up as you usually do. Okay, and then you get the cane, or that long, very long, tall cane. And let's just take a walk outside for a minute. Now, is that hand a bit cramped as well, that right hand? It seems stiff and cramped up. Okay. All right, so let's take a turn this. Okay, we're going to walk outside and just see how you walk on the sidewalk, okay? Be careful not to trip there. Turn and walk that way, and I'll tell you when to turn around and come back to me, okay? Okay, go ahead and show off. Wow. Wow. And turn around and just walk out towards the door and then... Look at that. And you can come on back in. Okay, go ahead and show off. Wow. Wow.
Are you someone who's getting older, and as you get older, you feel like your strength in your legs is just not the same? Are you having difficulty getting up out of a chair or sitting down into a chair, getting in and out of your car? In this video, you're going to see the incredible results that are happening with a patient who's under my care. This man was born in 1950. He is a Vietnam veteran, and his weakness in his body was just incredible, where he struggled to get up out of a chair and struggling to walk with a staff constantly, you know, a long cane type of staff. His balance was very poor. He would fall when he would step, and he had numbness throughout his body after, unfortunately, cancer treatment a few years ago. And he also had this one symptom of intense itching in his body with about 40 years with this experience of itching in his body, that he said it was deep inside the blood, the itch. When he'd scratch, the itch would not go away. He was under the VA care. He did not get the results that he hoped for. He found my clinic because of a patient who's his sister's close friend, and the sister is the caretaker with this patient who comes to me from the Virgin Islands for his Parkinson's. And this patient had seen, before he became a patient, he had seen such incredible improvement in this man with his Parkinson's condition under my care, only from under my care, that he said, "Who is that doctor? I've got to go see him." Basically is how it happened. So this man came to me for the first time in September of 2018. He explained to me about all these symptoms that I just shared, including which he had frequent urination at night, 5 to 10 times at night. His memory had gone down, bowel function down, numbness in the neck and the hands and the legs and the feet and the low back, numbness on the right side of his whole body, which is worse than his left. This man, let's look at this video right now. And then we're going to I'll present to you the exam findings, very unique exam findings in my clinic. So let's look at this video right now, which is pretty incredible. In video, there's only about maybe 30 seconds in length. You're going to see him sitting here in my clinic, trying to get up. Pretty difficult. And you're going to be able to see the difference after his after his second protocol, after about 6 months of care. And he can stand up with the greatest of ease. Pretty incredible. So I'm going to tell you also, in addition to the incredible change of him being able to stand up with no assistance, he can walk without the cane. And I did record a video of him walking without the, I should say, the staff. He can walk without it, although his pattern of walking is still very difficult. I shouldn't say difficult. Let's just say that it's not a normal pattern of walking. Yet he can walk without the staff now, even though the pattern of the walking is still the same as it was before. Yet he can walk without the staff now because what his wife told me was he used to fall. If he took one step without the staff, he'd fall. Now he can walk back and forth. Even though the pattern doesn't look very stable, he's walking, he's not falling, which is incredible. He also told me that his bladder is no longer out of control so many times at night. He also, because he now reduced to maybe going to 1 time at night instead of 5 to 10 times at night, he also told me, very happy, he told me that his numbness in his whole body has reduced about 20 to 30% after his second protocol with me. He also told me that the itching pain, the itching discomfort, the itching sensation that he had for 40 years is totally gone. 100% gone. And the way that it's gone is because of, with this unique examination that I perform in my clinic that got him to improve, to be able to stand up without any extra effort, that got his itching to go away, that got his balance to come back, and to got the numbness to be able to decrease, is because I practice a very unique neurological type of evaluation along with a very unique bioresonance evaluation in which I can find which kinds of infections and toxins are within which tissues. And I can provide safe and effective, very powerful, potent remedies which will remove these infections and toxins that I find in the exam process to remove it from the specific tissues where they're located. So let's get into the first examination finding here. I found that in his lymph, back in September of 2018, he had propofol, which is a general anesthesia chemical, and the lymph is throughout the entire body. I found propofol, Demerol, which is a pain reliever, muscle relaxer. I found midazolam, sedative chemical from previous surgeries. I also have samples of the Agent Orange. I found the Agent Orange in his lymphatic system and provided a remedy to rid it. I found the tetanus bacteria and the malaria parasite and dengue fever and parasitic flukes and the polio virus and antibiotic residues in his lymphatic system. Your body cannot heal. It cannot function right. Your nervous system, your cardiovascular system, nothing can work well when your lymphatic system is overwhelmed with infections and chemicals. I provided remedies to remove all of those from his tissues. I also found that he had in his left kidney, he had Agent Orange. He also had more of it in his right kidney. I found he had parasitic flukes in the left and the right kidney. I found that he had parasites in his blood. I found he had ringworm in his capillaries. Ringworm can make you itch. Ringworm in the capillaries. You have capillaries everywhere in your body. Every microscopic little measurement of every single little bit of tissue has capillary support throughout the heart, the brain, the arms, the legs, the hands, the feet, the skin, the bones, everything. Your muscles, capillaries are all throughout. Ringworm. We provided remedies to remove the ringworm from his capillaries. Maybe that's what reduced his itching. He had parasitic flukes in his glial cells. Glial cells are cells which repair your nerve tissue and reproduce the myelin. What happens to your central nervous system and peripheral nervous system tissues when the glial cells that do the repair and reproduction of these tissues, what happens when they're infected? You can't repair and reproduce. I found that he had the West Nile virus in his lymphatic system. I found that he had the polio virus in his glial cells and his cerebral spinal fluid. He had the polio virus. That fluid goes in and around the brain and spinal cord. I found he had the Agent Orange in a part of the brainstem called the red nucleus. The red nucleus of your brainstem, upper brainstem to be exact, the red nucleus helps to control motor function of the body. What happens when it's infected and toxic? It can't help you control motor function, so you can have weakness in the limbs. I found also that he had the polio virus in his meninges, which are membranes around the brain and spinal cord, which have nerves and blood vessels which go into the brain and spinal cord. I also found the polio virus in his spinal cord. This is with a very unique bioresonance method. I'm not going to describe exactly how I do it. Very unique bioresonance method. There is no biopsy of tissue. No, there is no, what do you call it, spinal tap that's done. No MRI is going to find this either. He came back to me between September and December of 2018. Very little, if any, improvement. We had to get rid of all of those that I found in his tissues to be able to set the stage, to be able to start removing other things. But very little improvement, very little change at all in his numbness, in his bladder control, in the itching, in the standing up from the chair, and the walking without it. And he was still in a very bad place. So now in December, I found with him that he had mercury, he had Agent Orange, he had lead, he had propofol, general anesthesia, Demerol, Roundup weed killer spray, parasites, 3 different parasites in his kidneys, all causing his kidneys to not work well, which also causes the legs to be weak and the hips to be very stiff and weak. I also found that he had, because he was consuming pink sea salt, and that pink sea salt contains mercury because it's coming from a part of the ocean where there's mercury dumping. So if the fish contain mercury in certain parts of the ocean, so does the salt that's coming out of those parts of the ocean. So I found that the mercury compound that was in the sea salt he was consuming was in his kidneys also. I provided remedies for all of those to remove those from his body. I found that he had the Agent Orange in his small intestine, provided remedies for that. I also found that his kidneys, his blood, his cortex of his brain, his aorta, which brings the blood to most parts of the body, he had malaria in there. His capillaries also had malaria, the parasite from malaria. I provided remedies for all of these parts that I just shared with you from these exam findings. And when he came back to me, which was in April of 2019, again, look at the video of him standing up from the chair. It was so difficult for him in September, so easy for him in April of 2019. The itching pain completely gone from his body. The itching discomfort, the itching sensation from his body is completely gone. He suffered 40 years with that. He can walk without his staff, without falling. He's got bladder control that has come back, and his brain's starting to feel clearer. How amazing is that? In this April exam, which will send him on a journey of a 3-month protocol, just a little bit less than a 3-month protocol, I found more infection in his body, and I found more mercury. I'll tell you what these were. His blood infected with toxoplasma bacteria, enterococcus bacteria, and pertussis bacteria. He had a small amount of Agent Orange left in his blood. His lungs had pertussis. His bronchi, which bring the oxygen from the trachea to the lungs, his bronchi had toxoplasma and enterococcus bacteria. His diaphragm, which is connected to the whole nervous system, cardiovascular system, and many organs and bone, the diaphragm had toxoplasma infection. The stomach had enterococcus infection. He had some chemo agents, chemo from what he had done. He had chemotherapy agents in his intestine, his small intestine lymphatic tissue known as the Peyer's patches. He had chemo in there. I provided remedies to remove it. He had chemo in his lungs. He had Agent Orange chemical around his lungs in the pleural cavity. He also had tetanus bacteria in certain tissues. He had tetanus in his cerebral spinal fluid, which is the fluid which goes in and around your entire brain and spinal cord. He had tetanus in his brain. He had tetanus in his prostate. He had tetanus in his pia layer of the meninges, which directly connects to the brain and spinal cord. He had toxoplasma bacteria in the pia layer of the meninges as well. I also found that he had staph infection, Staphylococcus bacterial infection in his cerebral spinal fluid, his ureters, and his kidneys, and some mercury in the kidneys. Provided remedies to remove all of these infections and chemicals, and I get to see him again in maybe another 3 months. So I will be able to report more for you when he comes back in. I just think it's too incredible, the recovery that's taking place for him, to not share these findings without any other sharing the other parts of a video I shared. I'm waiting for even more impressive than what we already see here, more impressive findings to share the next video after his next part of recovery that I can share with you of even more impressive results happening here. You should subscribe to my YouTube channel and turn on notifications, hit the bell to turn on notifications for when I put up new videos, because you can get new videos from me via YouTube. They'll send you an email that I put up a new video, and you'll know right away, and you can watch some other incredible recovery taking place in my clinic. Also, you can, if you wish, like and follow me on Facebook. You can follow me on Twitter, on Instagram, and I put a post on there on those social media sites on a regular basis. You can call my clinic when you're ready to become a patient here at 954-370-3100. That's 954-370-3100. You can even send an email to my clinic assistant at our office email address at office.askdrherman@gmail.com. That's office.askdrherman@gmail.com. And my assistant will be happy to make an appointment for you in my clinic. People travel to my clinic from other parts of Florida, other parts of the United States, and other countries, including Canada, United Kingdom, Mexico. We've had from Romania, Norway, Netherlands, Thailand, Israel, China, Russia. We've had from Australia. We had from Africa coming into my clinic. There's people from all around, okay? Italy coming here. So there's people from all around. So you can, depending on how severe your problem is and how much help you want, you can make a decision to come to my clinic from a pretty far away place, as other people are doing, and you can start to work with a very unique mind and a very unique method to be able to start to pinpoint and safely remove these hidden disease-causing infections and toxins, as other people call the root causes of your condition, and help you recover and help you regain function. My name is Dr. Herman, and I am dedicated. I'm here to help you get well. You or a friend or a family member or loved one, to help you them get well. Contact my clinic at 954-370-3100 or by the email address for the clinic here, and my assistant will help you make an appointment. Appointments are an average, if I didn't say this already, appointments are an average of 2 hours, maybe 2.5 hours in my clinic, and you go back home and we ship you the protocol. And you follow a protocol at home for about 2 months, maybe 3 months, depending on the case. Some people experience very rapid recovery, very rapid improvement in their function and reduction in their pain and their symptoms. Others, it can take time. Nobody knows how many different infections and toxins you have in different tissues of your body. So right now, I'm showing you a result. It took us 6 months to be able to get that incredible improvement with him, just about. Experience that incredible improvement with him. It took time. It took time, okay? But he's seeing it, he's living it, and enjoying it, and his wife too. His wife is so happy for him. And them, of course, because she sees that he can function again. You know? Incredible. Insurance companies don't cover this type of work that I'm offering, so this will be an investment in yourself. I look forward to helping you. See you soon.